No? Yay?
Yep.
Maybe so?
What's their 6100 series? Anybody remember? Physical fitness or physical readiness, I believe is the other thing right here, right?
Physical fitness.
So
6100 through 6199 are all about physical fitness.
DHA is telling me, is my service member physically fit after, or before and after a deployment?
Everything I do is I break down everything. If you break it down by the primary, secondary, you ain't gotta worry about no third. Tertiary, I don't know how to say that number, so don't judge me. Tertiary number, alright? So, DHA process. You're gonna hear DHA. Do not get DHA confused with the Department of Health Agency. They're not talking about that. They are talking about deployment health assessments, alright? So, with that being said, deployment health assessments are used to screen service members prior to deployment to identify health concerns after deployment and to facilitate appropriate care. So there's 3 different reasons why we do DHAs. All right. So you screen them you screen them prior to deployment. All right. You identify health concerns after deployment, and then the third is you facilitate appropriate care. All right. Just like anything else, pretty much you figure out what's broke with them now. You send them out to deployment. You bring them back. You do an assessment to see what's wrong with them, and then you give them the care to treat what's wrong with them if they received any type of diseases, illnesses, injuries while they were deployed. All right. There's 3 documents that you need. Deployment health assessments consist of 3 components. Your DD-2795. Everything is always in chronological order. Everything is always easy. So 2795, your DD-2796, and your DD-2900. The reason why I'm saying these numbers like this is because what comes first? If you think about the 3 things that we do, what comes first?
Pre-deployment.
Pre-deployment. What comes after that? When you come home from the deployment, you got to do what? Do your post-deployment. Then when you do your post-deployment, you got to do what do we do after that? You got to reassess after everything. All right. So if you remember in that aspect, you will always remember these numbers. DD-2795 is the pre-deployment health assessment, or AKA PDHA. Because you will hear people say, have you done your PDHA? Then you have your DD-2796, your post-deployment health assessment, your PDHA as well. It's the same thing. One is pre, one is post. You're going to hear people say it. You just got to remember if you just came back from the deployment or if you're about to go to a deployment.
Which one would you do in conjunction with your PHA? That's recently new. You're going to be PDHA. So if you notice, when you go to do your online PHA, there's the option there to do your PDH, your post-deployment health assessment on that same site.
Technically, you can.
Can you do all of them there?
So,
Carriers that require any like pre-deployment, post-deployment stuff.
Is that a question or a statement?
Statement.
I didn't hear what you said. Can you say it?
Aircraft carriers don't request or require the post-deployment health
Do you know
assessment
why?
and assessment.
So the reason why, if you're on an aircraft carrier or if you're on a ship, the reason why you don't have to do this because you guys constantly go on deployments is because before you went there, you did a suitability screening. That suitability screening states if you're eligible, if you technically are able to go to get deployed. If you didn't know that, right? So if you're going OCONUS, you got to do a suitability screening. If you're going to operational, right? Technically, it's just an operational screening. It's to figure out if you can either go to this operational platform or if you can go overseas. If you have something that goes on, will you be able to have, whether it's you or a family member, can they be treated if anything goes wrong, right? That's why if you have EFMP, you got to go certain places. You can't go to certain places, but you have to do a screening, right? If you have certain illnesses, right, that's why they don't kick you out the Navy for everything. Some things you can stay in the Navy for, but if you have something certain, if you have certain things, you can't go to certain ships because of one, they may not have the medical coverage that you need just in case something happens. For instance, you cannot go to a submarine if you have diabetes, right? But you can be on an aircraft carrier if you have diabetes, right? So you got to think about that's why you don't do one of these if you're going to a ship. This is mainly for people who are kind of in a hospital setting and you are getting deployed on either individual augmentee, maybe you're going to support a request for services overseas, or you got a question? Oh. So if you have not already done an operational or / suitability screen, all right. So then you got your DD-2900, your post-deployment health reassessment. Obviously, after you do everything, anytime you give any type of care, you always do what? Right? Same thing if I put a tourniquet on, I'll do what?
Reassess.
Right? So think of it in that aspect. If you think about those 3 things, a PDHA, It's just got your post or your pre, your post, and your reassess. Simplest way to remember. All right. DHA process. DHAs are limited to periods of 30 days or greater. Why? Because most likely if you're not gone for 30 days, you're not going on a deployment.
What have we learned also about that 30-day thing? That's why this is here. Reservists, right? Because when they are 30 days or more, they're on the active status, and they still need to be evaluated if they're going on a deployment for that time frame.
Exactly. Remember that 30 days or greater. All right. Deployment defined as the relocation of forces and material to desired operational areas. Now, do you see why aircraft carriers do not do this? Why you wouldn't do this? Because the deployment defined as the relocation of forces and material to desired operational areas. Aircraft carriers technically are always relocated, right? So even though it can be pierside or in the yards, technically they're. If you think about the Navy, they say we're what 24/7. Well, aircraft carriers are technically ships are 24/7, so they're technically not being redeployed. Even though they say it's a deployment, it's really just going underway. All right, so this is why you will only do DHA process when it comes to deployments. Is if you're being, let's say if you're at EMF Juliet, right, or if you're at like they got a new EMU that we got, or ERSS and all those different types of units, right? If you're at those units, then you would do stuff like this. You don't do it if you're on a ship. Redeployment is the return of personnel from deployment to the home or demobilization station for reintegration or out processing. I know it sounds backwards, right? Redeployment, you would think that they're getting redeployed. No, it's just coming back home. All right, that's all that is. All right, what constitutes as a deployment? Ashore for more than 30 days with duties involve Operation OCONUS without a fixed MTF, right? So what that means is, if I'm here for more than 30 days with duties involving operations overseas without a fixed MTF, meaning if I go to Iraq, technically there's not a fixed MTF out there, but we have different row cares. Am I saying that right? Row cares? Because you got like row 2, row 3,
row
out
1.
there. Different types of rows of care out there. Okay, I think that sounds better out there, right? So remember this: if you're ashore for more than 30 days with duties involving operations OCONUS without a fixed MTF, so you got to be ashore, but technically OCONUS. Another reason why ships don't come. I'm gonna keep just so you guys can understand, because I like breaking things up so we can separate big Navy from Navy medicine. Because like I said the other day, we're really weird. Like we're weirdos. We're great. It's great to be a corpsman, but the way that they got us working, I don't, sometimes I question it. So the combatant commander, service component commander, or commander exercising operational control determines a health threat exists regardless of deployment area, duration, or MTF support, right? So everyone knows the different COCOMs that we have, right? The combatant commands. Who does not? Raise your hand. So the different ones we have, I'm not going to name all of them, right? You've heard of SOCOM, I'm pretty sure, right? Special Operations Command. You got Northcom, which is pretty much us, right? And you got UCOM, which is Europe, and then you got PAPACOM, you got Southcom, like you got all these different comms. It's really 8 of them. All it is just pretty much whoever the commanding general is, and it's normally, if it's a combatant command, there's not going to be no Navy. It's usually some general that's sitting up there.
So I don't want this to get confused, because I know some of us know the deployments in our terms are longer than 30 days, but this is 30 days based off of the criteria it is mentioning here, right? When it's involving operations OCONUS without an MTF, this is what's constituting as a deployment for 30 days. Because we know some deployments as 6 months, right? So in the context of the questions on the test, if it's mentioning this specific wordage, it's going to be 30 days.
But you about to see something about the 180 days, so just wait. All right. DHA policy. DHAs are complete electronically and reviewed by healthcare provider. There are only 4 people who can do it, or 4 flavors of people. All right. Your physicians, your PAs, physician assistants, your NPs, nurse practitioners, or IDCs. Those are the only 4 people who can sign off on it. We as corpsmen cannot, unless you are specified, went to school, and had the NEC of an IDC. All right. The pre-DHA will be administered at home station or in MPS no earlier than 120 days prior to expected deployment date. Right? So if I'm supposed to go January, what's this, August, what's this, August 3rd?
Yeah.
August 4th? August 3rd.
Third.
Right? If I'm supposed to go and get deployed March 1st of next year, can I go get my PDHA right now? Right? Because it's outside of 120 days. And the reason why is because from 120 days now, or taking to now to 120 days, something can go wrong really, really bad, and then I am no longer considered to be able to be deployed, so it would be pointless for me to do it within that window.
To me, this is also an outlier. I don't really see 120 anywhere else in the bibs.
Yeah.
So I would just annotate that is unique to see the 120 day mark here for the DHA.
Everything's usually 90, 30, 60, or 180. So, the post-DHA will be completed close to return date as possible, but no earlier than 30 days of expected redeployment date and no later than 30 days from deployment.
So I have an easy way to remember this. Think about Iraq and Afghanistan. What was the biggest combat injury that people were coming back with? PTSD, right? So would you want somebody who has potential PTSD going past 30 days of being seen after coming back from deployment? No, you want to see them as soon as possible, so you're going to have to see them within 30 days of coming back, right? And then they would then fall into that redeployment assessment if we think that they're still good to go to maybe go on another deployment if that PTSD has not made the situation worse.
And then RC members shall complete before being released from active duty.
So the post one is before you get 30 days before you come back?
The post,
So post is
No.
once you get back and you are able to go anywhere else, you have to have this assessment done within 30 days.
So-
Earlier than 30 days of expected redeployment date.
So that's
But you just said redeployment.
so no other than say it should be
that's
the other
what
way
I said, it's
around.
confusing.
So this other one should be the first part of the sentence. Sorry. The not later than 30 days should be up here because basically once you get out of deployment, you have this. Now say they're getting you ready for the redeployment that he was talking about on the previous slide, right? So before you go and redeploy, whatever that redeployment date is, you have to be seen within 30 days to that redeployment date.
So, if you didn't know, if you get deployed, you come back, you have a thing called dwell time. Right? So dwell times means that there's a certain amount of time you have to wait before you can be redeployed. And it sometimes goes 2 for 1. So every, or 1 for 2, 2 for 1. So for every 1 day that you did deploy, you gotta wait 2 days. So dwell is 2-1, 2 days for every 1 day that you deploy. So if I deployed for 180 days, I got 360 days of dwell time before I can technically be considered redeployable. So when it comes to that 30 days, right? So right before my 360 days of dwell time ends, I have no earlier than the 30 days to do that, right? Because if I do it any sooner, what can happen, or if I do it any later, what can happen is they can say, hey, you're about to get deployed, and because I didn't have one done in a timely manner, now I'm not able to be deployed. And guess what the Navy has to always do? We always have to be deployable, right? That's why you always gotta have your dental class, you gotta have your PHAs done, you always gotta be ready to deploy. That makes sense? I know it's very, very confusing, but if you remember the numbers, it's a lot easier.
So that's not how it's
is there-
written.
I'm sorry.
Isn't this talking about redeployment as in how you
As in
describe it
integration,
as
yes.
before you get back?
Yes.
So you have a 30-day period before you get back that you can start it?
Yes. So
Right.
so if I'm in Iraq, right, about to come, I can start it, but I can't finish it until I get back because
Okay.
I'm not out of the zone yet.
Okay.
That makes sense?
And then you have to get it done,
Again, before I get ready to get deployed again.
okay,
That makes sense?
yes.
That's how it was, right?
That's how it is.
Yeah, okay.
I was just talking about the dwell time, sorry. The dwell time was just something extra I was adding on. But yes, that's how that is supposed to be rated. So you start it on your way back. So a lot of times if you go to like places like Iraq, when they come back, there's this thing called WTP, Warrior Transition Program, where it's like, I wanna say it's 2 weeks of time where they pretty much, it's that redeployment where they're reintegrating you back to civilian, or back to coming back from out of a combat zone. Within there, that's where they're gonna start your process, to say, hey, what is everything you went through, everything that happened, so when you get back, you can finish up the process of, this is what I know I went through, because they've already documented everything, they do a physical over there to make sure that I'm good to go. Cause what they don't wanna do, like you said, is come back, and you got someone who has PTSD, and you wait until after 30 days, and then you try to go find this person, cause they don't show up for an appointment, and guess what happened? Something happened to them, or they did something to someone else, because you weren't able to properly diagnose that PTSD, because you didn't see them. That makes sense? I know this stuff is confusing, just remember the numbers. I'm a numbers type of guy. If you remember the numbers are a lot easier, because this is the only one that has 120 days. Yeah, that's reserve component. Yeah, so like if, has Black been taught yet?
Yeah, not yet.
Okay.
She usually just teaches the lab section.
Okay. So the PDHRA shall be completed between 90 and 180 days after redeployment, right? This is that reassessment. This is the third one. What form do you use for the reassessment? You said 29 what? Yes, the 2900, right? So you got to complete this one between 90 and 180 days after redeployment, all right? The reason why is because within that time frame, you should have been assessed. They should have put in some type of medical treatment plan for you to execute. And now they're checking up to make sure everything is going on, and they continue to have another plan to move forward. That makes sense? Anyone got questions about that? No? All right, so service members who deploy for more than one 30-day period in 12 months will receive a PHDR concurrent with annual PHA. So, you understand what that means? If I get deployed twice for 31 days within 1 year, when it comes time for my PHA, I'm just gonna do my PDHRA. Do you understand why? Nope, cool, I'll tell you. So you remember that dwell time I said? So if I do 30 days, if I do 31 days reservists are deployed, I gotta wait how many days? What did I say the dwell time was? 1 to 2. So I gotta wait, or 2 to 1. So I gotta wait how many days if I do 31? 62. That takes me to what? 3 months, right? I get deployed again for another 31 days, right? I gotta wait until how long before I can get deployed again? So that equals up to 6 months, right? I have to wait. I have to get it completed between 90 and 180 days. 180 days is what? It's 6 months, right? So if I've already done 6 months worth of dwell time in deployment, the next exam that I have coming up is my PHA. So I can just wait until it's time for me to do my PHA, because some people's PHA may fall within a month or two after they deploy. So there's no point of going to do a PHA one day and then having to go and reschedule for your PDHRA another time. So you can concurrently do those. So remember that, all right? If you separated from active duty prior to 90 to 180 day window for your PDHA, you must receive concurrent PDHRA and separation health assessment. Everyone does realize when you separate, you have to do a PHA pretty much, right? Who did not know that? Raise your hand. It's okay. Cool. Remember that. So when you guys go to separate, that's the time where you get everything written down so that you can get your VA benefits if you serve. RC service, hey, some people don't serve, I don't know. RC service members returning to drilling status must still complete PDHRA in required timeline. All right, that's all that is for that. Service members who are overdue for PHA, post-DHA, or PDHRA cannot complete NAPR 6110/3, RPARF, Q, and PRIMS, and cannot complete PFA until all requirements are met. Anyone want to know why? Anyone have an answer why you can't do that?
We don't know if you're healthy.
Exactly, right? Don't know if you have healthy, right? So just like how we have to do our PHA, our regular PHA, our physical health assessment, right? These are just as important. If we don't know what happened, because you may be injured from doing your deployment, and you may not be able to do a PRT, right? So remember that. All DHAs are completed and submitted via this website right here. It's the Naval Medical Center, Public Health, Navy Marine Corps Public Health Center, which is now the Force Health Protection Command, if you didn't know.
And as I mentioned before, when I did the PHA instruction with you guys, just for your own knowledge, when you're trying to do the PARFQ, again, you got to remember that you're projecting out your PHA date to the PRT date, because you might be good now when you're asked to do your PARFQ 2 months early, but then your PHA is dink before your actual PFA, and you're still not going to be able to complete it. So always project out to the actual PRT date for everybody getting their PHAs done.
Now, this is kind of remember this when we were talking about how Opnav instructions, UMed instructions and stuff like that, right? When you read the instructions, it tell you certain things. So service members supported by Army or Air Force medical providers can use the Army's medical protection system or Air Force's Aero Medical Services Information Management System. Ooh, that's a lie. And a printed copy will need to be electronically signed and kept in member's medical record. This is one of the reasons why this is that type of instruction, because you can get it signed off by another service member's providers. All right, because they also have their own requirements when it comes to PDHAs. They have to do the exact same thing when it comes to it. All right. All right. So here's the one thing that you want to remember, right? It's going back to the responsibilities and everything. All right. So Deputy CNO, N1, they develop and maintain DHA policy, but they provide quarterly compliance to CNO. Remember that, quarterly. Every quarter they have to go up to the CNO and tell the CNO, hey, this is what we're looking like when it comes to deployability status of the Navy. All right, so remember that, they got it, because it has to be told to somebody, because guess what, we got to be a deployable ready service at all times. That's why we're 24/7. That's why we got to stay up on our dental. That's why we got to stay up on our shots. That's why we got to stay up on our PHAs. All right. Commander U.S. Fleet Forces Command, which is really cool because they're right around the corner. They provide quarterly compliance to the Office of CNO N17 by the 30th of the month following the end of the quarter.
Put a star next to that.
Put a star next to that. When is this quarter end? We're in August.
We're in August, so it ends in October.
Ends in September. But guess what quarter just ended?
Second.
The third quarter just ended, right? So what date did they have to send this up? No, you're right. July 30th. So they just did it a couple days ago. Fleet Forces had to tell the CNO, because this is a Fleet Forces Command program. You didn't know. There's some things that we control, but there's some things that they control, right? Anybody heard of imparts? Who's heard of imparts? You guys heard of imparts? So imparts is a cool site that is utilized by all commands, right? You know how you got your, where you go and do your PARQ, all that stuff, right? You have your IMR, which is MERS, right? We have this cool site called imparts. Imparts is ran by Fleet Forces Command. What that means is we have to make sure that our IMRs are updated right, by making sure we get the right shots, dental, PHAs, and everything, right? That is then fed to your POMI teams in the hospitals. Your POMI teams then update imparts. Imparts is then provided to all of the COs. COs do it to all their TICOMs. TICOMs then provides all this information to Fleet Forces, so Fleet Forces can then brief CNO about the readiness. So, if your dental is not good, it's going to show their dental is not ready, their dental readiness is low because we have one person whose dental is low. So think of it in that aspect, right? It's just another system that they use to show this, so that Fleet Forces can then tell the Deputy CNO, the Deputy CNO can then tell the CNO. All right.
Somebody was asking about this the other day. We're talking about your N codes and M codes. Again, this is the only other N code you'll see besides Surgeon General. So you have your N93 for Surgeon General, and then N1 for Deputy CNO.
Look at that, I was teaching both of them. Mm-hmm. And N4, we talked about N4 too, supplies, because I talked about that too.
Well, that one's M4.
N4.
On the instruction, it's M4.
It's switched though, it's now N4.
Okay.
That's why I was
instruction for study.
That's why I told him. That's why I told him when I taught it the other day. It's M4 and M00 or M4B. What was it? M4B.
It's M4 and M6, I believe.
No, there was one that we were talking. 4.6. That's what.
4.6. There you go.
You add another one to it and they directly.
Exactly. Yes.
Yep.
So the office of CNO is in 17 because guess what? Office of CNO still falls under the deputy CNO. So that's why you got the 7 on the second because it still falls under the office of the deputy CNO. So it's in 1-7 that still falls under. So when you look at those codes, the codes are really confusing. But just remember, this is what it's only 3 codes we talked about.
Yep.
This one.
Surgeon General was the other one.
General. Other than that, don't worry about end codes because they get really confusing. So ViewMed shall, all right, this is what, as ViewMed, this is what they must do. They must provide command level medical services for service members to complete DHAs, maintain deployment health centers to provide support for service members to complete health assessment processes, provide Opnav N17 medical policy guidance related to DHA process. Navy and Marine Corps Public Health Center is responsible for maintaining EDHA database.
Put a star next to that one.
So star next beside that, because that tells you who is responsible for maintaining that database. It's public health. Alright. They validate DHA status during PHA. Incomplete DHA will result in incomplete PHA. Provide education and training, DHA policy, medical guidelines and procedures, and information technology systems to healthcare providers, right? So when we used to have CHCS, Alta, now MHS Genesis, these are the systems that we utilize to make sure that everyone's medical status stays up to date, such as also as IMRs. That's something for you specifically as an individual to be able to maintain their own medical readiness.
And again, this all makes sense what I talked about earlier. ViewMed is all about guidance, policy, and support, right? All these responsibilities literally fall into all of those categories on what their role is as ViewMed.
DHA policy right there. Educate and train. All right. Operational command shall use MERS to identify service members who require DHAs. Send lists of service members to command reps in charge of monitoring DHA compliance and provide health record review for DHA deficiencies upon check-in and check-out, right? When you check in, you turn in your medical records and check to make sure everything's good to go, right? Super simple. CO shall ensure. So don't get too caught up in the weeds when it comes to this, right? You got your ViewMed shall, operational command shall, CO shall, right? They're not really going to ask you when it comes to DHA policy who it is. It's more or less the timelines and the purpose of it, as well as the documents that you guys have to worry about. Service members deploying to areas requiring physical health assessments are briefed on deployment health threats. Service members, so what that means is if I'm going to a place where we talk about the vaccines and the
Chemoprophylaxis.
Yes. Couldn't remember. Right? So if you're about to get deployed, guess what? Your command should be telling you, your command, which is why it says CO, right? Your command should be telling you, because you belong to that command, hey, you're going into this area, you need to have this series of anthrax shots. Right? Service members complete all health assessments within prescribed time frames. Service members who have any health concerns receive appropriate follow-up with medical providers. DHA status is validated upon check-in and check-out process. This is the easiest one to remember because if you remember what you do when you check in or if you're going to get deployed, you fall under your CO. That is your CO's responsibility to make sure that all this is taken care of. Active duty service members stationed remotely from an MTF may call the DoD-sponsored PDHRA call center at that number. Reserve PDHR can be completed at NOSC or Navy Operational Support Centers. Coordinated on-site screening event or by calling the DoD-sponsored call center. Reserve members indicating health issues on the PDHRA may be approved for a one-time line-of-duty authorization for a medical evaluation to determine if a condition which requires treatment exists. That makes sense? Pretty simple, right? NMPS shall. Now, all service members complete or have completed their PDHA and ensure follow-up for any identified concerns. All conditions resulting in a non-deployable determination shall be documented for further follow-up by service members' primary care physician upon return to the parent command or NOS. IA redeploying service members complete post-DHA and active service members indicating issues shall receive appropriate documentation for treatment by their PCM upon return to the parent command, right? These are things that you gotta remember that you need to do because ain't nobody gonna tell you that you need to go set up another appointment to see your doctor unless you just don't care. Alright, but I hope everybody goes get seen for everything. Oh, that's it. Well, here's the form to cut off. I don't here, let me show you real quick. Just so you can see the differences and then I'll let H1 go. Just so you guys can see the differences of them.